How much sleep do you get? How much sleep do you think you need to get to be healthy? You know, we've always had that standard 8 hours of sleep. Is that accurate? A new study from Columbia University, published in the journal Nature, suggests that there's a sweet spot for adults, and it's less than 8 hours. Joining us now to discuss these and see what his thoughts are on this is Dr. Andrew Stiehm from Allina Health. You specialize in sleep medicine. Tell me again here. I mean, I was looking at your everything you cover, and it's sleep medicine, but you're talking about narcolepsy, insomnia, apnea, restless leg syndrome. I mean, there is a whole host of things here that affect the quality of our sleep.
Yeah, well, it is absolutely true. I mean, sleep is 1/3 of human existence, and there's a lot of diseases that can impact 1/3 of how we live. Things that make it hard for us to get sleep, weird behaviors we do while we're asleep, like sleepwalking, sleep talking, and disorders of being sleepy, like sleep apnea or narcolepsy. I mean, there's a lot of diseases we can squeeze into that 1/3 of our lives.
Yeah. So what's interesting is that there's a lot of things that affect our sleep, health-wise, that affect the quality of sleep. But then conversely, the quality of sleep has so much impact on various health conditions.
Absolutely. One of my favorite examples is pain. And so people with chronic back pain will get understandably poor quality sleep because their back hurts. But poor quality sleep will also magnify pain. And so the two disorders really feed off each other to the extent that people who get poor sleep will feel more pain, and people with more pain will feel the need for more sleep.
Interesting. I mean, it's just constantly, and I know with so many sleep studies and clinics, where you can come in and have your sleep analyzed and to see what can you do, what's causing your sleep to be problematic. In this case, in this study from Columbia University, again, this is not a study that you were a part of. Wanted to get your thoughts on your expertise. This is something you focus on. As you read this study, and their conclusions are that too many hours of sleep and too few hours of sleep both cause you to age faster. Your brain, your heart, your lung, your immune system, etc. And their sweet spot, they had it between, what are the numbers? It was between 6.4 hours and 7.8 hours a day. So for a lot of people, that less than 8 hours. What are your thoughts on those conclusions?
I find they ring true. We've got multiple studies that would suggest the sweet spot probably is in the 7 to 8 hour window for most adults. And this one kind of focuses a lot more on specifics. It looks at brain aging, liver aging, and it looks at human aging. And it kind of finds that those that get less than that 6.4 hours of sleep, those organs age faster, the cardiovascular system, the brain, et cetera. And those that get more than 7.8 also age faster. And we see those negative health effects when people get too little or too much sleep.
So when you talk to somebody who says, you know what, I only need 5 hours of sleep, that works for me, or somebody who said, you know what, I need 9 hours of sleep, do they really only need that little or that much? I mean, is it that much variable, or are you saying, you know what, I think you might need to adjust your range?
It's a both and, it's not an either or. So there certainly are some people that only need and are successful with 5 hours of sleep. And then there are some people who may have the belief that they're doing okay on 5 hours of sleep, and they're not doing as well as they should be. And so we kind of need to be attentive to both sides of that coin. I like a personal story, which is mine, which is if I don't get my 8 hours of sleep, I'm a real jerk to be around. And if my wife doesn't get the sleep she needs, she's as pleasant as could be. You couldn't even tell that she was underslept. So two different people respond to sleep deprivation in different ways. And the same thing is true of many of us. Like I might need 7, but if I only get 6.5, I have an half hour more productivity, and I'm willing to pay that price. But what this study does point out is that there is a price. If you're getting less sleep than you biologically need, your brain gets older faster, your heart gets older faster, your kidneys get older faster, and there is some truth to burning the candle at both ends.
So how do you determine with somebody what their sweet spot is? What point do they need to target in order to slow aging of all these systems in our body?
That's an individual conversation that has to happen with the patient right in front of you. I mean, what this study does point out, it looked at about 500,000 people, and there's this bell curve, and so most people kind of fit in the middle of the bell curve, but there certainly are some outliers on both the I need extra and I need less sleep. And so when you're talking to a patient, you have to start understanding, like when I meet with you, are you waking up to an alarm? If you're waking up to an alarm clock, kind of by definition, you're sleep deprived. You're not waking up naturally, you're waking up artificially. How do you feel when you're driving, when your brain is a little bit inert? Do you find your attention wandering? Do you find you're going to want to take a nap pretty easily? That might also imply you're pretty sleep deprived. So you kind of have to ask some of these evocative questions of patients to find out, are you someone who's getting 5 hours of sleep and it's a habit, or are you someone who only needs 5 hours of sleep?
And then there's folks that may feel like they're getting enough sleep in terms of the clock, but it's not quality sleep, which is, again, some of the things that you will study with people to see what is the actual amount of sleep that you're getting.
There's a lot of truth in that. And so one of the common sleep disorders that we'll see is this disease called obstructive sleep apnea, where people are sleeping poorly because they're not breathing well while they're asleep. And so this is someone who might be telling me, I'm getting 7 or 8 hours of sleep, I'm getting 9 hours of sleep, and I'm still exhausted. And so we kind of have to find out about the quality of their sleep in that way. And quality of sleep implies different things to different people. And this is always kind of the second tier question I have to ask. People come to me all the time saying, I have poor quality sleep. And I have to say, what do you mean by that? Do you mean I wake up a lot? Do you mean I feel unrested when I am awake during the day? Do you mean like when I'm driving, my eyes are heavy and I want to fall asleep? I'm getting in trouble at work because I'm falling asleep in meetings. I mean, these are all the questions that we have to ask when someone reports poor quality sleep, because they mean so many different things by it.
Okay. And then lastly here, I think it's obvious why too little sleep affects the aging of your heart, brain, etc. How does too much sleep trigger the same effect?
Great question. And it's one the authors pondered a little bit as well of this study, because it looked like the association between too little sleep and bad things was direct. I mean, there was a direct consequence. But they posited that too much sleep might actually be more a reflection of the other issues. So for someone who has other medical problems, one of the consequences to those medical problems, diabetes as examples, might be I wake up more and urinate more through the course of the night. Or someone who's got a prostate cancer might be waking up and urinating more through the night. Or someone who's more depressed might be spending more time and sleeping more in bed as a result more of the depression. And it may be that the too much sleep is more a marker of fragility or the other problems as opposed to a direct causal agent.
Interesting.
But it's kind of consistent across studies. People that get under 6 and over 9 hours of sleep, we see bad things as long-term consequences.
Interesting. All right. Well, what's your best recommendation here for what people should do to figure out how to get better sleep?
I say two things: trust yourself and trust your partner. So if your partner is telling you that your sleep quality is not very good because they're lying next to you and they observe problems, let your healthcare provider know. And then also be insightful. If you're having trouble staying awake in meetings, staying awake on your commute, just feel your sleep quality is poor, or waking up more than you think you should, there are things that we can do to help. There are specialists out there and your medical provider in your primary care clinic who want to help you with these problems. Just bring it up to our attention.
All right. Sleep better, age better. I like that combination. Dr. Andrew Stiehm with Allina Health, thank you for your insight today.
My pleasure. You have a good afternoon.
You as well.